Hello and welcome back to my channel, Skincare with Deborah Diane. Today we are going to be talking about oncology aesthetics. We're going to ask 3 questions. What is oncology aesthetics? Who is considered a survivor? And if you're in treatment or post-treatment, why you want to go to someone who is certified and trained in oncology aesthetics. Before we get started, I want to give a shout out to an interview that I did recently on the Wellness Coach podcast. So I will have the link in the description below. So after this video, go ahead and check that out. I go into more details on oncology aesthetics, aroma touch therapy, and overall skincare. So check that out after you're done with this video. I also want to do a little disclaimer. Sometimes when we talk about the subject of oncology, cancer, it can bring up a lot of emotions. So take a minute. If you feel something coming up, pause the video, take a deep breath. I will gently send reminders throughout the video when I feel that I need to take a deep breath. So what is oncology aesthetics? Oncology is cancer. So according to the National Cancer Society, 1 in every 2 men and 1 in every 3 women will get cancer in their lifetime. So reports and studies have also shown that that number can increase, especially in the younger generations, 20s and 30s. I recommend you do your research, and I recommend that you keep yourself and your family protected. So oncology aesthetics. Aesthetics is skincare. Aesthetics is the science of the skin. So for me personally, there's a lot of different estheticians. There's some estheticians that just work on waxing, that just work on eyelashes, that just do makeup. I specialize personally in skin science. And I'm also certified in oncology aesthetics through OTI International. I will have the link to that website below as well. It is a phenomenal education, and they also have a free webinar on YouTube that you can check out. So I will have the link to both of those below. So when you talk about cancer, there are over 200 types of cancer that a person can get within their body. Big breath in and exhale. When we talk about specifically skin cancer, there are 3 major forms of skin cancer. The first is very surfaced. It's on the epidermis layer of the skin, the very surface, and it's basal cell carcinoma. Now, if basal cell carcinoma is not found and treated, it can move into the lower layers of the skin, the dermis layers, and that is squamous cell carcinoma. Now, if that isn't treated, it can turn into melanoma. Now, melanoma is the deadliest form of skin cancer. Breathe in. The reason is because it can spread very quickly. It can start attaching to different parts of the body. It can travel throughout the body, and it can affect the what's the word I'm looking for? Organs of the body, and it can also go into the bloodstream. Big breath. Okay. I talked in another video about free radicals and how free radicals can affect and damage the DNA and the cells. Damaged cells is what causes skin cancer. So when you go to someone who is an esthetician, just even if they're not trained in oncology aesthetics, but if you get regular facials either by an esthetician or by a medical esthetician, now I do want to say that there is a difference. So an esthetician that works in a spa, it feels absolutely incredible. And they're working with the upper layer of the skin. So they are focusing on exfoliating the dead skin cells and hydrating and soothing the skin. And it is phenomenal. Now, a medical esthetician, they focus on the deeper layers of the skin. So they're actually working with the live cells within the skin versus the dead cells. So I didn't know if you knew that, but there's some information for you. Both a medical esthetician and a regular esthetician that is specialized in skin science, they act as a screener for your skin. They can also help you strengthen your skin, and by that is acting as a preventative for skin cancer. I also want to say, if you have someone that you love to go to, then awesome. The main thing is when you go to someone consistently, I personally recommend getting a facial at least once a month. Yeah, at least once a month. But more importantly, if you're going to someone consistently, so you're not changing around estheticians, you have one particular esthetician, they start to get to know your skin. They start to understand how your skin works. And they are the best screeners for your skin because they see it continually every month. And if they're doing analysis, which they should be doing every time, they're going to see anything that's starting or any abnormal growth, anything. They also can check for moles. Now, I do want to say we are not diagnosing. We do not diagnose. That would be a medical professional. If we see something, we will refer you to a dermatologist or to call your doctor, but we do not diagnose. Okay. So I want to talk a little bit about who is a survivor. Now, if you're touched or have been touched with cancer, you are a survivor. Even if it was 20, 40, 50 years ago, you are a survivor. If you had something removed thinking it could be cancer and you had to wait and get tested, you are a survivor. You are still going through those questions in your head. You are still going through those emotions. You are a survivor. Now, of course, going through treatment and post-treatment, you are also a survivor. We're going to take this a step further. If you're a caregiver to someone who has or had cancer, you are a survivor. If you've had someone in your family that has had cancer, or a loved one, even a friend, someone that has had cancer, or someone who has died from cancer, you are a survivor, because cancer changes everything. It changes everything. So you are a survivor. Now, going back to the question on why see somebody who is trained for oncology aesthetics. One of the trainings, as I said, I was with OTI International. One of the biggest parts of my training is ingredients within the products. So when you are on medications for cancer, when you are doing treatments, that can take so much toll on the body. Your body, your beautiful, amazing body, is working so hard to heal itself. Okay, just think about that. Just think about how hard it was to heal itself. Now, the medications can have contraindications to ingredients. Now, it's not only ingredients that you take into your body, it could be ingredients that you put on your skin, that you wash your skin with, within your makeup, within your shampoo. Okay? So, oncology estheticians are specifically trained to know the contraindications of your medications versus the ingredients that are going to be used on your skin. I personally feel too that when you go to someone who is trained in oncology aesthetics, we understand what the body is going to go through. We understand the motion sickness. We understand the sensitivities to fragrances. We understand that you might just get sick. We understand and we're able to adapt. So when you go to someone who is trained in oncology aesthetics, we modify everything for that person each time. In my office, the first visit is always 2 hours. We go through medications, we go through intake forms. If you're in treatment or post-treatment, and you have to remember too, post-treatment can be up to a year. Okay, up to a year. On a side note with that, I want to say something else. When you're done with your medications, okay, and this can be with anything, not just cancer, but when you're done with your medications, your body is still going to release the toxins. And your skin is the communicator. So if you go see an esthetician and you're like, hey, I've been off my medications for a year and I still got this rash, your body is still releasing. And you have to remember too, that when you're working with an esthetician, when you work, especially a medical esthetician, they are moving things to the surface. Okay, they're working with that live cells to move things up to the surface. So if you have any residual toxins in your body, it is going to come out onto your skin. So you just want to make sure that you have amazing open communication with your esthetician. Now, back to what I do in my office is the first treatment is always 2 hours. And then after that is usually 90 minutes. And I will require a doctor's referral if you're in treatment or post-treatment for up to a year. It's just something that I do personally to protect you and to make sure that everyone that's working together is working together for you and we're all on the same page. Also, back to an oncology aesthetics, they will make sure that they have specific products that are safe for either cancer patients or patients with any kind of immunity deficiencies. because we want to make sure that your body is working to help you, not to fight off some sort of ingredients that is put on your skin. So most estheticians and spas, they have one, maybe two ingredients that they work with, and it isn't necessarily specific for cancer or for somebody that's going through cancer treatments. So that's just another thing to think about. Okay, I hope that you enjoyed this. It was super short, super to the point, but I want to hear from you. So if you have any other questions that you would like answered on aesthetics in general, skincare, or oncology aesthetics, leave it in the comments below. I will definitely take the time to answer them because it's something that's extremely important. If you like this video, go ahead and check out the other videos that I have. Please subscribe to my channel and like this video. Share this video on your social media, and we will see you again.